Good morning, and to our friends joining us abroad, good evening. I am your host, Christy Idlekeeper. Welcome to Mirage Talks. The subject, does exercise weaken the immune system? We bring to you sports nutritionists and psychologists with the understanding that timing is everything. Yael Dror, how are you feeling today?
Thank you very much for inviting me. And I just want to mention that for me, it's a good evening nowadays. Uh, I'm in Israel. So good morning, good afternoon, and good evening to you all. Um, so we can start.
Absolutely, let's get started.
Okay, so first of all, I want to introduce myself. So my name is Yael Dror. I'm a sports nutritionist with a master degree in physiology. I used to live 5 years in California in the Silicon Valley when my husband was doing his postdoc. And nowadays we are back in Israel and I'm the head department of a very, very new nutrition department in a sports medical center in Haifa. It's called Medics. It's only 3 months old, and I hope it's going to be one of the biggest medical sports center in Israel. So if you are in Israel, you're more than welcome to come and visit us. So the topic of today talk would be about the connection between exercise, immune system, and nutrition, because I want to show you a few things that maybe nobody has been speaking about, because everyone is saying exercise is so healthy and so good for you. But from what I know nowadays, many people are engaged in sports, and sometimes it could be more intense than what they think. So let's talk about this topic and let's understand how we can protect our body. So when we're talking about
Yael, you're muted.
uncut, can you hear me?
Perfect.
Great. So many people start to exercise in purpose to improve their health. But what we know nowadays that studies showed that in the long term, exercise reduces the risk for many diseases. And we're talking about, for example, heart disease, diabetes, cancer, high cholesterol, high blood pressure, obesity, and of course, the metabolic syndrome. So in the long term, yes, exercise definitely is recommended and have a very, very good influence on the body. But what we need to talk today is about the effect of the exercise on the immune system, short term versus long term, because it's not necessarily the same thing here. So, what exactly happened in the short term of the exercise and after the exercise? And could it be that exercise has a negative effect on the body during the time of the exercise and in the short term following the exercise? And let me show you what I'm talking about. Because during the time of the exercise, something happens inside the muscles. Um, the muscle create free radicals and ORS, that those are reactive oxygen species. What happened is that when the body the muscle create those components, there is a situation of oxidation stress, meaning the pH in the blood, in the body, is going down. And that could be a really serious situation. And that could damage the DNA, it can damage a few tissues. So the body needs to protect itself against the free radicals and the ORS. And lucky for us, the body knows how to protect itself. And we know that the body has different kind of enzymes. For example, glutathione, superoxide dismutase that deal with the free radicals. We're getting vitamins, for example, A, C, E, that they protect the body. We got antioxidants components. For example, ubiquinone. I think most of you know them as Q10. We have flavonoids. We have different components that the body create in order to protect itself during the time of the exercise. So the body knows to cope, the body knows to deal with this stress, with the oxidation stress, but that's something that would be in process, meaning it's taking time to the body to produce the amount that it needs in order to protect the situation, to protect the tissues. So in the long term, yes, the body is creating more natural antioxidants, and the natural defense of the body is stronger and better, and the risk for many disease is lower. So in the long term, yes, we are getting more healthier if we are engaged in sport. But the question is it enough? And there are two situations where the natural defense is not enough. And we're talking about the first one when you're getting into shape because the body is not producing enough natural antioxidants. And when you're training really intense, when the load is very high, and when you engage in competition, for example, then the body is not capable of producing the amount of antioxidant that you need. And that's a situation when your immune system could be not enough and not protecting you against different kind of disease. So what we need to talk today is about moderate physical activity versus intense exercise, because when you're doing a moderate activity, and it could be prolonged, intense exercise, that could cause a raise of the risk of different type of disease instead of protecting you. The intense exercise could damage the function of the immune system. And I want to show you a few examples. So what happened when you're exercising? So a few things changed in your body. For example, the temperature of your body is raising during the time of the exercise. I don't know if you notice, and maybe that would be a good things to check. But for example, when you're finishing marathon, your body temperature would be between 41 Celsius degree, and I think that's going to be 110 Fahrenheit. So that's really, really high. And they're going to be increased in the blood pressure, also increase in the number of breaths per minute, and increase in heart rate. So all of those symptoms together give the body the conclusion that the body is sick, meaning the body is like looking to fight against something that raise all those symptoms, that those are exactly like a sickness. If you would look at this chart, you would see that what happened exactly during the time of exercise is very similar to what we see sometime during a sepsis infection. The increase of a few anti-inflammatory cells is really looking like between sepsis and exercise, interleukin-6, interleukin-10. So something happened inside the body during the time of the exercise. The immune system is starting to shake, and the body knows that that's not a sepsis situation because of the TNF alpha, that it's not raising up during the time of the exercise. But the immune system is definitely not in a normal place. So the body trying not to attack itself during the time of the exercise, because the body understands that that's not a sepsis situation. So the way of the body to deal with this situation is by blocking the immune system function during the time of intense exercise. The body is doing it by secretion of stress hormones, for example, cortisol, meaning that while you are exercising, something is blocking the immune system ability to protect you against different source of virus, bacteria, and other source of infection. You are exercising, you're feeling full of energy, but you need to understand that it's a very delicate situation because your immune system is not functioning. So what happened is that body is blocking the immune system at the time when you need it the most. And as the intensity or the duration of the exercise is going up, then the blocking of the immune system going to be longer than before. And we can see a few changes in the immune system, in the skin, in the upper respiratory tract, in the lungs, in the blood, in the muscle tissue. So different area in the body are influenced from the exercise, and the immune system is not capable of protecting you well as it was before the exercise. And that's something that continues also after the exercise is ending. So the post-exercise, and I'm talking about intense exercise, not just walking, in the park, but when you're doing something and it's intense, take control, understand that your body maybe is not capable of protecting you because the immune system is not functioning well. And what is how to understand and to know which kind of exercise would block the immune system. So first of all, when you're doing prolonged exercise, if it's above an hour and a half, that would be a situation the immune system maybe would not work well after the exercise. When you're doing a moderate to high intensity exercise, we're talking about between 55 to 75% of VO2 max. And when you're not eating properly before or during the exercise, that could also be in a high risk of damaging the function of the immune system. So if you enjoy, for example, a long run or cycling, or you're going to the gym for intense exercise, or you're doing HIIT exercise, or different kind of really high blood rate and heart rate, you should know that maybe you're enjoying the exercise, but your body is not protected. So if we're talking about intense exercise, and it definitely could be a delicate situation. So acute intense exercise could cause a decline in several of components of the immune system. And that could go up to 24 hours after the exercise, meaning that you've been finishing the exercise, you're taking a shower, you're feeling well, but everything that goes around you, all the virus, all the bacteria, everything around you, you are more sensitive to get them 24 hours after intense exercise. And if the recovery between exercise session is not sufficient, for example, if you are exercising in the evening time and you're getting up in the morning to do another session, if it's something that continues, maybe that could be a temporary decline of the immune system, but that could be a chronic problem if you're not giving enough time to the body to recover from one session to another. And it's possible that it can combine a few small changes, but many of them in the immune system function, and that could lead to a definitely damage of the upper respiratory system. And I want to focus on it in a few slides in the continue of the lecture. But I want you to understand that even though you went to the exercise in your goal was to improve your health, maybe at the hours after the exercise, you're more sensitive to get any germs that is around you. And we're talking about the open window stage, because it's could be a few hours after the exercise that your body would not be able to protect itself because the immune system is suppressed. And when we see it in athletes, for example, so we see elevation in stress hormones, we see pro and anti-inflammatory cytokines, and we see a very high levels of the ROS, the reactive oxygen species, meaning there is a window, a time when your body is trying to cope with all the stress, but at the same time, the immune system is blocked. So the immune system cannot help the body to protect itself against other germs, bacteria, and viruses. And studies have shown that this open window could last between 3 to 72 hours. It means that between 3 hours after the exercise, up to 3 days, sometime. If it's really intense exercise, your body would not be able to protect itself against different germs. And for example, we know about athletes that engage in marathon, ultramarathon, Ironman, and cycling, long distance cycling. They definitely suffer more often from different colds and disease, and find it sometimes really hard to continue their training program because they're getting sick all the time. And people at work saying, but you're training all the time. How come you're sick and having the cold all the time? And that's something that they need to take in concern, because they are exercising and they are in good shape, but at the same time, the immune system is not recovering well after the exercise. And one of the weakened point is the upper respiratory system, because that's the first line where all the germs and the viruses are entering the body. So that's the first place that the body needs to cope with them. And if the immune system is not working well, they could definitely find a solid place to grow. And what we saw in studies is the episode of upper respiratory syndromes in athletes do not follow the usually seasonal pattern of the upper respiratory symptoms. It's more goes according to competition and intense exercise. So it's not just springtime or wintertime to get cold, but for athletes, that's usually could be around competition, and that's the worst time to get sick. And the symptoms occur more frequently, for example, during high intensity training, during a taper time. I don't know if you're familiar with this term. Taper would be the week or two before the competition. After a month of exercising and preparing the body, you're taking the load of exercise down, for example, a week or 2 weeks before the competition. But that's a very delicate time for the body because the immune system is not working well, and many athletes are sick before the competition. After the competition, if you've been trying to go for any kind of race or competition, many people experience being sick the day after the competition or the week after the competition. We're saying to ourselves, oh, all the stress went down, so my body is like allowing itself to get sick. But no, the immune system is not working well. And for example, after a marathon, we saw that it could take a week for the immune system to come back, to get back in shape and to protect itself. So you need to help the immune system against all the germs around you. Following increase in training load, sometimes you are training very hard and then the coach or somebody tell you, okay, you need to get up, you need to do it more, you need to run more, you need more intensity. So when the load is already high and you increasing it, then that could definitely influence the immune system function. And what we saw in studies that when you look at elite athletes, so bacterial infection would be in 5% of the athletes. A viral infection would be in 30 to 40%. And that's a lot, but unknown source of infection would be between 55 to 65% of the athletes. And what we know is that most of the time when an athlete is sick, until the time he would go to the doctor and check it, it could take a week, because most of the time they would say, okay, I'm going to manage, I'm going to eat something, I'm going to rest, and they don't take care of themselves. So most of the time we don't know the source of the infection, but we need to help the immune system recover, because without any rest and proper nutrition, the body will not be able to cope with the source of the infection, even if we don't know what it is. And if we're talking about viral infections, there is high percentage of elite athletes with recurrent upper respiratory symptom associated with long-term fatigue and poor performance. Many of them have herpes group virus or Epstein-Barr virus, if you know EBV, and the frequency of EBV exposed is different between different type of sport. For example, EBV is very common between swimmer, triathlons, wrestling, for example, and that's something that we're seeing recurring. We're seeing over and over again. And getting well from EBV could take months. That would be a very bad situation for the athletes. So we are trying to protect the athletes. We're trying to make sure that they would help their body, the immune system function well. That could be a challenge. So what would be the risk factor for the immune system function? So overtraining, if the athlete is training too much without any rest, a lack of a complete rest day once a week. I don't know if you're familiar with it, but I'm working with so many athletes and I'm demanding them to have a rest day, a complete rest day. And they argue with me. They demand to continue to exercise every day because they feel that if they will do more, they will get to a better place. And I'm trying to explain them that they have to have a complete day of rest, and it's not easy to convince them. Also, a situation when there is an increase in load, when the total load is already high, and when there are too many competitions. I don't know if you're watching the Olympic Games. In order to get to the Olympic Games this year, they needed to go for many competition in different countries. They needed to prove that they are capable and qualified to the Olympic Games. And some of them, I just saw yesterday, some of them saying that the body is aching. They're exhausted. They got to the Olympic Game, but they're in a very, very high load of intensity, and definitely sometimes their body is not dealing with it. Even though they got to the Olympic Games, they need to have a proper rest, and sometimes that could ruin their chances of winning. But I want to take you now to my field. I want to take you to the sports nutrition and to understand how we can cope with the blocking of the immune system, how we can help the body by choosing the right foods and the right timing of eating. So what can you do to help the immune system function properly? And surprisingly, after the exercise, immediately after the exercise, to eat carbohydrate. I know everyone is talking about proteins and how much you need to eat, and high protein here and high protein there, and the bar and the shakes. But if we're talking about the immune system, we're talking about carbohydrate. And what we need to understand that as long as you are exercising, until you eat, the cortisol going to be high. And the cortisol is blocking the immune system functioning. So what happens is when you're eating carbohydrate, the insulin is raising and insulin is reducing, lowering the cortisol levels. So here, the insulin and the carbohydrate are the good guys in this story, meaning you need to have carbohydrate right after intense exercise in order to lower the cortisol and help the immune system function again. I know we love to hate the carbohydrate, but here they are the good guys. And what type of carbohydrate? Here, surprisingly, we want the high glycemic index carbohydrate. We want them to be absorbed fast in the body. Of course, a good source of carbohydrate. We're looking, for example, fresh fruits, dry fruits, fruit juice, because I know many people are not capable of eating after the exercise, especially after a competition or after intense exercise, because adrenaline is so high. You don't feel hungry, but you need to take care of your body. You need carbohydrate. For example, you can make yourself a smoothie, an energy bar, even a cereal, handful of cereal would be fine. Slice of bread with honey, with jam, peanut butter if you want. But you need to have carbohydrate immediately, or at least in a short term after the exercise. Another thing that we need to make sure is to have more antioxidant, natural antioxidant in our menu, meaning we need to combine food rich in natural antioxidants every day. And here are a few examples of superfoods that you can buy in your daily menu in order to have natural antioxidant. For example, chia seeds, avocado, nuts, berries, orange, green tea, broccoli, cinnamon, pomegranate, bananas, and mango. All of those fruits are really high in natural antioxidants. And if we are focusing on a special antioxidants, natural ones in the food, we are talking about the polyphenols. And the polyphenols are characterized as antioxidants, anti-inflammatory, cardioprotective, anti-carcinogenic. So those natural foods are so powerful. And to combine them in our daily menu is very, very important. And here I want to show you a few more examples of different types of polyphenols in the nutrition. So we have quercetin. Quercetin you can find in onion or in broccoli. We have the EGCG. That's a very, very strong antioxidant that you can find in a green tea. Turmeric. Turmeric, the yellow seasoning, is very powerful. Try to use it more when you're cooking. Lycopene. Lycopene is a very strong antioxidant. You can find it in tomatoes or in tomato sauce, but I would have to say that eating the fresh tomato, you would get less lycopene compared to cooked sauce of tomatoes, because when you hit the tomatoes, when you cook it, then the lycopene is more is very easy to absorb comparing from the fresh tomatoes. So definitely combine fresh and cooked tomatoes. And there is another antioxidant that you can find in olive oil, in pepper, in celery. So we have so many options of fresh and cooked vegetables and seasoning and tea that you can buy in your daily menu in order to protect your body and help the immune system function properly. And I just want to show you two headlights of papers about green tea and the effect of green tea and how it's raised the amount of antioxidants markers after exercising and in different sports. And I would give you the bottom line. The recommendations are to drink 3 cups of green tea a day in order to get a very high levels of natural antioxidants in the body and to protect the muscles. So that's, for example, a very delicious and easy way to help the body and the immune system. What about supplements? Should we take antioxidant supplements in order to help the immune system? So the answer is no, because what happened? According to studies, high dose of antioxidant supplements can harm the body's natural producing of the natural antioxidants, meaning that when you're taking mega dose of antioxidants, then the body is not coping, the body is not producing enough antioxidants by itself. So we want to get the body in shape. We want the body to create the natural antioxidants, not from supplements. The food is a great source, but don't rely on supplements. Let the body cope, let it produce, let it create the natural antioxidants. And here, for example, is a paper that checked different types of supplements on athletes and how it's affect the body. And you can see that vitamin didn't help, vitamin C didn't help, multivitamins, they did have a positive influence. You can see here, for example, BCAA and different probiotics, they didn't help. But carbohydrate, definitely within 60, after the exercise, around 60 grams of carbohydrate help the immune system function properly. They also check, for example, omega-3 and other herbs. But here again, quercetin was definitely recommended after the exercise in order to help the immune system function properly after the exercise into the open window stage when the immune system is not working properly yet. Quercetin definitely was found to help. So if I want to summarize everything that I talked here about, athletes, coaches, medical persons, they need to be aware of the period where the increased risk of illness occur. For example, training, when they are intense weeks of training, the taper time before competition and during competition. But each one of us needs to be aware. And we're talking about planning recovery program and to make sure that we have enough rest between sessions, to pay particular attention to recovery and nutritional strategy, meaning we need to understand to eat at the right timing after the exercise and to make sure to have lots of antioxidants in our menu. Thank you very much.
Well, thank you, Yael. This is something I'm very passionate about, exercise and nutrition. So thank you very much. You definitely shared a lot and enlightened me and our Mirage tribe, of course. We did have a question that was sent to the chat box to get started. Is this mainly related to aerobic exercise, or does this apply to anaerobic as well?
Anaerobic as well. It depends on the intensity. Usually what we know that an exercise less than 30 minutes usually would not damage the immune system, but if it would be above 30 to 45 minutes intense exercise, then that's something that we need to take in concern. If it's a moderate exercise, aerobic exercise, then usually we're talking about an hour and a half. Less than an hour and a half moderate exercise would not damage the immune system. So moderate or intense weightlifting or cycling, it's depend on the time and the intensity.
Okay, excellent. And we have another question. Is there any difference between men and women in this capacity?
Not necessarily. I think it would be maybe connected to age more, but men and women in this field are the same.
Okay, excellent. Do we have any other questions, or if you want to unmute yourself and ask Yael directly?
Hi, this is Joel. Fantastic presentation. It's almost a shame that so few people are on this call, because I know so many people that will benefit, and I will certainly forward your presentation. I had heard somewhere in the last, I don't know, 6 months or so, I have done some running, never anything too long. I have done a marathon and half marathons. But I read that people who do marathons actually do not live as long. I think it was some kind of a statistic along those lines. Is that something that ties into what you're saying, or in fact, is that even true?
I have to say that those studies are changing all the time. And I think nowadays a marathon would not be so intense comparing to what people are doing. And I think that nowadays the knowledge of how to take care of your body is much wider. and people are more professional, even if they're amateur. Nowadays, people are taking care of their body. So I think a marathon is not necessarily any danger to the health nowadays, as long as you're taking care of your body, resting, eating, making sure that you're taking the right supplements. If something is missing, for example, people that are engaged in aerobic sometimes suffer from deficiency in iron. So as long as you're making sure to do a blood test every year and you taking care of your body, I think that would not be any risk for the health.
Okay, thank you. It's funny you mentioned supplements, because I think in your presentation you were kind of suggesting maybe not.
So let me be really clear about it. Mega dose of antioxidants are not recommended because they're blocking the ability of the body to cope with the stress, with the oxidation stress, and to produce the natural antioxidant. But if there is a deficiency in, for example, iron, B12, vitamin D, if there is a deficiency that you saw in the blood test, you need to take a supplement in order to get it to the right level. But just taking mega dose of antioxidants, that's not recommended.
Got it. Thank you.
Do we have any other questions for Yael? Well, I have a question that I'd like a little clarification on. So, the idea that after your workout, you are carb loading, that I grew up in a generation where it was you're supposed to pre-carb load before you do an intense workout, but you're saying it's better after, not before.
No, I didn't say about
Okay.
not. Okay, so let's make it clear. Before the exercise, you need to have carbohydrates, specifically if you're doing an aerobic prolonged exercise, because you want the glycogen storage to be full. After the exercise, what I'm saying that even if you don't feel hungry, have a bite of an apple. Take a banana. You don't need to have a huge amount, but you need to give the body at least a little bit of carbohydrate in order to lower the cortisol levels. So it's not a full meal. You don't need to have like a big sandwich, full of carbs. You just need to have a little bit of carbs, but that should be immediately after the exercise.
Great. I love that tip. Thank you. Thank you.
You're welcome.
Do we have any additional questions?
Well, not the questions, but just to say that I was a patient of Yael many, many years ago, before doing my first marathon, and it was quite great experience for me. And I fully recommend, and I see that you are still professional and still attractive. So thank you so much.
Thank you.
Thank you for sharing those things. Thank you. All right. Well, on that note, on behalf of Paul Mirage and the Mirage Institute, Yael, thank you so much for taking the time and enlightening our Mirage tribe. Thank you everyone for joining today, and highly appreciate you. We'll see you next time.
Thank you for having me.
Thank you.
Good. Thank you so
Good
much.
night, good morning, good afternoon.
Love it, Toph.